However, for vaccination against hepatitis B, vaccination has been shown to be protective, highly protective against it in 95% of individuals, 95 to 99%.
Okay.
However, before one gets vaccinated, the individual has to be tested for the viral infection.
Okay.
If a test is done and the person is positive, then that person will benefit from treatment and evaluation from doctors, specialists in particular.
Okay.
However, if the test is done and it's negative, that's when you will now get vaccinated and then get protected against the virus, because someone already has disease condition. So why try to prevent something that is already there? So you treat it.
You treat it.
Yes, instead of vaccinating the patient. So for those, we've had cases where patients come to us and tell us, I'm vaccinated against it about a year or two ago. I'm wondering why I'm having the viral infection now with the complications. And we simply educate them that they should have been tested first of all. So that's the teaching. And in every notable public hospital out there, even in the teaching hospital, even in private settings, we advocate, please test your patient first of all for the virus, viral hepatitis B. We even move on to do C and then HIV, because they tend to move together, given the fact that the mode of transmission are more or less like the same. Okay. So we test for it, and then before you get vaccinated, depending on the results,
the outcome of the test. Thank you very much, Dr. Asa. So that's simple. You only get vaccinated if you test negative to the screening test for hepatitis B. Okay, so if somebody who has the disease already would not need to be vaccinated, rather the person will need to be evaluated by specialists and then go on for treatment. So you were trying to tell us why we need to be concerned about hepatitis, about the viral hepatitis. Yes.
So based on the statistics we given earlier on, that's the 296 million people worldwide. We have it at greater than 25%, that's 81 million of these individuals are actually living with us here in Africa. And then only 6.9% have been diagnosed. And even out of the 6.9%, only 22% are actually undergoing treatments. So we now see that the burden of the disease is actually large. And in Nigeria, that's the next one.
Okay. Hello, good afternoon.
Hello, good afternoon.
Good afternoon. Please, can you tell us your name and where you're calling from?
My name is James. I'm calling from Calabar.
Okay. Yeah, sure. Okay, yeah, go right ahead.
Okay, sometimes when I was looking for it, I started taking the hepatitis vaccine.
Okay.
And I think I had it years or so. Do I need to continue from there, or is there something else I need to do?
Okay, you're working in Port Harcourt and you took a dose of the vaccine, just one dose.
Yes.
How far back? Okay, you're now in
last year.
Last year. Okay.
Yes.
So your question is,
Yes.
Okay, your question, what's your question exactly?
My question is, do I need to continue taking the other doses of the vaccine? And then, is there any place in Calabar where I can get proper testing or continue taking my vaccine?
Okay, all right, thank you very much. Dr. Asa, the questions are just taking us further down to the part that we're not yet, but that's no problem, we'll handle it anyway. So that's the question.
For the vaccination, what based on studies that have been done, one is expected to be vaccinated at the first point of contact, that's the first dose. Then the second dose is gotten at least 4 weeks after the first dose. Okay. And then the third dose is at the 6th month. That's after the first dose. Okay. So we always advise and then we educate individuals and comments on the vaccination schedule to ensure that they follow it through till the end. Okay. You take it the first month, 1 month after the first time, 1 month after, and then 6 months after. So this one you had a break for a long period of time now, for a year as well. So it means you need to start again and then ensure you follow that you follow through till the end. Okay. Please.
All right. So he also asked where he can get the vaccine. So that's what he asked.
Yes, the good thing is now it's something, the awareness is getting stronger, and then we have various places in town where one could get vaccinated, tested and vaccinated. Teaching hospital, the community medicine department
department
offers that service. General hospital also offers and
Okay.
similar services. Then we have some non-governmental organization, non-profit based organization that are also offering the same services at various spots in town, probably
Okay.
trying to take it closer to the people.
Yes, because we
I'm
need
aware
to-
of one at West Pharmacy and then one at Western Pharmacy, where they
Okay.
actually do the testing and then go on ahead to vaccinate the individual.
Okay. All right.